Welcome to the SPRAVATO Administration Guide, where you will find the information you need to start your patients on SPRAVATO. Before self-administering SPRAVATO, SPRAVATO nasal spray is self-administered by the patient under the supervision of a healthcare professional. Prior to self-administration, you should check the patient has not consumed any liquid within 30 minutes, eaten within 2 hours, or administered nasal corticosteroid or decongestant sprays for 1 hour prior. You should also check that the patient's blood pressure is within a normal range and that they are not pregnant or breastfeeding. Lastly, you should ensure the patient understands they must not drive or operate machinery until the next day after a restful night's sleep. Concomitant use of SPRAVATO and central nervous system depressants may increase sedation. Concomitant use of psychostimulants or monoamine oxidase inhibitors may increase blood pressure. Closely monitor patients when these medicines are used with SPRAVATO. The SPRAVATO nasal spray device at a glance. The device should be held with the tip pointing up, index and middle fingers should be placed on the finger rest and the thumb gently supporting the plunger. The device should not be primed. Patients should only press the plunger to deliver SPRAVATO. This is the nose rest to help the patient insert the device to the proper depth and angle. And this is the spray indicator that shows you how many sprays were delivered. Each device only contains 2 sprays. 2 green dots means the device is full. 1 green dot means 1 spray was delivered and no green dots means the device is empty. Administering SPRAVATO. Step 1. Get ready. A patient may be assigned 1, 2 or 3 devices. Confirm the dosage and number of devices needed before administration. Before the first device only, ask the patient to blow their nose. Step 2. Prepare device. Peel the blister and remove the device. Check the indicator to make sure it shows 2 green dots and then hand the device to the patient. Step 3. Prepare patient. The patient should hold the device with their thumb gently supporting the plunger and then recline their head at about 45 degrees. The patient should stay in this position during administration. Doing so helps keep SPRAVATO inside their nose. Step 4. Patient sprays once into each nostril. The patient should insert the tip straight into their nostril. The nose rest should touch the skin between their nostrils. Proper alignment is important to allow SPRAVATO to be fully absorbed in the nasal cavity. The patient should close their opposite nostril, breathe in through their nose while pushing the plunger all the way up until it stops, and then gently sniff. The patient should switch hands, insert the device tip into their other nostril and repeat the same steps to deliver the second spray. Step 5. Confirm delivery and rest. Take the device from the patient and check that the indicator shows no green dots. If there is a green dot, the patient should spray again into their second nostril. Check the indicator to confirm the device is now empty before disposing of the device in accordance with local institutional Schedule 8 policies. The patient should then rest in a comfortable position for 5 minutes to allow SPRAVATO to absorb. If any liquid drips out, the patient should dab their nose with a tissue. The patient should not blow their nose after spraying SPRAVATO. If the patient's dose requires more than 1 device, the same steps should be repeated, with the patient resting in a comfortable position for 5 minutes after each device, and they should not blow their nose. Administration is now complete. Confirm that you have all used devices and dispose of them in accordance with your local institutional policies for Schedule 8 medicines. The patient should not take any devices with them when they leave the SPRAVATO treatment centre, during and after SPRAVATO administration. During and after SPRAVATO administration, the patient should be monitored for elevated blood pressure, sedation, dissociation, and other adverse events until they are stable and ready to leave the treatment centre. The patient should have their blood pressure assessed at approximately 40 minutes after administration and then subsequently as clinically warranted. The supervising healthcare professional is responsible for assessing the patient's readiness to leave after their treatment session with SPRAVATO. Before the patient leaves the treatment centre, confirm that the patient's blood pressure has returned to an appropriate level and that dissociation, sedation, or other adverse events have resolved. It's important to remind the patient that they will not be able to drive or engage in any potentially hazardous activities until after a restful night's sleep. Finally, before leaving the treatment centre, confirm the patient has booked their next appointment. For more information, call our medical information team on 1800 226 334 or email medinfo@janau.jnj.com.